So we have seen the number of cases of COVID-19 continue to climb, but fortunately at a lower rate than we were seeing till recently. This is obviously a reflection of the impact of the measures that have been implemented and the fact that they're clearly the right ones and that people must be adhering to them because we are starting to slow the curve. Although I'd really caution people away from over-interpreting this because we are still seeing new cases and we need to remain vigilant to prevent those, but also remain prepared for the situation that we're likely to see in the coming weeks or months. In terms of the expected trajectory, it's really difficult to predict because we largely dictate that. So the more we do in terms of social distancing and staying away from other people and hand hygiene, the more we'll prevent new cases and significantly alter that trajectory. That's our goal. In terms of what we expect to see, it's likely we'll see cases continue to climb as we transition from largely imported cases to more community-based transition. And this is likely to occur in the coming weeks. But as I say, we can largely determine how much of an impact that has by doing all the things that we're recommending everyone do at the moment in terms of staying home, social distancing and hand hygiene. In terms of our planning for this situation, one of the things we're paying close attention to right now is the utilisation of PPE, including the correct stewardship of PPE so that we don't use it inappropriately and potentially compromise our precious resource. As we aim to be thoroughly prepared for this difficult situation, we're developing a large number of guidelines to ensure staff and patient safety throughout. A number of these relate to our utilisation of personal protective equipment, and we're doing this in accordance with the best information and evidence available at the time. We understand justifiably there's some anxiety around at the moment, particularly around the use of PPE. And I'd like to ensure everybody that we're developing clear guidelines so everybody knows exactly what they need to remain safe. The current guidelines on testing mean that any healthcare worker who has a fever or any symptoms potentially consistent with COVID-19, particularly things such as a cough or sore throat, can now be tested for COVID-19 either here at the Mater or closer to home if they're not at work. In accordance with the messaging around social distancing and restricting numbers of people that are entering the organisation, you would have seen that upon entry to the building, now you require swipe card access. We ask all of you to ensure that you have your swipe card so you can gain access to work, and also just to be mindful that the public, visitors or patients don't follow you through after you gain swipe access, as there's a process now on them gaining access to the building which is through an intercom system where they'll be screened to make sure their entry is appropriate.